My name is Aaliyah Kimpany, and this is my case study intervention plan. So, a brief occupational profile over my patient. She's 12 years, 11 months old. She had an intrauterine stroke, which led to congenital left side spastic cerebral palsy. She's being referred to occupational therapy to decrease spasticity of her left upper extremity, strengthen that extremity, and complete bimanual tasks more independently and functionally. And the setting is an outpatient. So, a brief introduction to her. Her max level is 2. Her GMFCS level is 1. Her weaknesses include range of motion, object manipulation, finger isolation, thumb opposition, and grip strength. Her strengths include she's cognitively intact, she's very determined, she has a strong family support system, and she has a great sense of humor. Her ideal environment is quiet spaces with few people. Her interests include baking, social media, spending time with friends and family. The constraint-induced movement therapy protocol that I witnessed included bimanual tasks in the morning where we worked on functional activities and ADLs. And then we would put a splint on her dominant hand and she would complete activities 2 through 5 with her non-dominant hand. We worked on outdoor activities, which targeted finding gross motor movement, lunch, where she did meal preparation and feeding, virtual reality, where she focused on grip, supination, and shoulder movements, and then board game time, where she focused on fine motor movements. After thoroughly researching beneficial activities for hemiplegic cerebral palsy, I found somatosensory therapy, which is a very interesting therapy that focuses on motor movements that are as a result of understanding the sensations that are around you. This includes tactile sensations and also proprioceptive sensations. So this activity would begin with a sensory board. You can really have anything on the sensory board. The patient would touch the different textures with her eyes open and then verbalize the different sensations that she feels. Then she would close her eyes and I would place her hand on a section of the board and she would describe it to me without her vision. And then we would work on pulling large beads out of extra soft therapy. We would discuss the textures that she feels as she's completing this motor task. And then when she's done, she would squeeze the therapy after all of the beads are out. And she would also continue describing the tactile sensations that are occurring whenever she's doing this. And lastly, we would do plastic egg cracking, where I would demonstrate how to crack an egg and verbalize the positioning of my body as I'm doing it. Then she would follow along after I run through it, and she would be the one who verbalizes her body's positioning. That way she gets that proprioceptive awareness. And we would repeat the activity with therapy inside the egg when she feels comfortable doing it without the added resistance. And during this, we would discuss the muscles and the parts of the body that are working while cracking the egg, and we would repeat this activity 10 times for muscle memory. So a big emphasis of this activity is that she's understanding the proprioceptive aspect of cracking the egg. That way she can eventually get to a point where she's able to crack eggs for her baking. And that's all I have. Thank you.